My hope is that by the end of this presentation, you feel more comfortable talking about vaccines with your patients and knowing what vaccines that they require. These are my disclosures. Our learning objectives is to discuss the importance of immunization for persons with diabetes, identify updates to the AACE guidelines just released, exciting, related to immunizations, and to discuss the components of the CDC standards for adult immunization practice. And then finally, to find resources and tools to learn more about these standards so we can apply them to our clinical practice. So why are we talking about vaccinations and increasing vaccination rates for our patients? First of all, we know that vaccines are efficacious in preventing vaccine-preventable illnesses, especially in high-risk populations like patients with diabetes. We also know that when unvaccinated, patients can have bad outcomes. This data talks about influenza and COVID-19, and patients that have influenza vaccinations had a 33 to 68% reduction in mortality, all-cause mortality, those that are more than 65 years of age. And talking about this mortality is often related to, like we know, influenza-related illness like pneumonia, but also cardiovascular disease. There was a 6 times increased risk of having cardiovascular disease amongst patients that had myocardial infarction, amongst patients out of Ontario in Canada that had an influenza infection compared to those that did not have influenza infection. So there's increased risk of cardiovascular mortality. Also, COVID-19, I'm sure we're all pretty experts on COVID-19 now. We know about increased mortality with diabetes. Also, patients with diabetes often are obese. They have hypertension. They're older. These are all risk factors for COVID-19. And we know that vaccines are effective in preventing adverse outcomes. There's 3 times increased risk of hospitalization and severe illness for those that are not vaccinated that have diabetes. And the last point I'll make is there's increased incidence of cardiovascular disease. And this particular study looked at over 5 million veterans, and they found that about 150,000 of them that had a positive COVID-19 infection had a 50 to 80% increased risk of cardiovascular mortality compared to those that did not have an infection. So there is a big impact we can make by improving vaccination rates for our patients. However, despite all of this information that we've just talked about, the vaccination rates are suboptimal. Okay, for example, influenza vaccines. This is data from the CDC, shows that 46% overall uptake for influenza vaccination. And amongst the high-risk population, which you would expect to be much higher, there's only 61% vaccination rate. So there's more than a third of our patients high risk, including those that have diabetes, that haven't been vaccinated. And that is the rationale why the CDC and AACE were trying to improve the vaccinations and try to spread the message about improving vaccinations. So, and how are we doing that? This is the just published AACE guidelines. We're all excited about that. There's a section on the guidelines that updates the vaccination recommendations. And the reason we put this on the guidelines is because we want to emphasize having these recommendations for vaccinations in the guidelines will elevate the guidelines, our awareness of the need to get our patients vaccinated. And also, there are some evidence-based recommendations that we can use to initiate conversations with our patients, other healthcare providers, and our staff. All of these efforts will help to improve the rate of vaccinations across our practices. In the guidelines, there's a specific, this table has a summary of the vaccines that our patients with diabetes should receive. And I'll point out that this table also has a recommendation to reference the CDC's website because, like we all know, vaccine recommendations might change with time. Example, COVID-19. And so we need to stay up to date. And as far at the time of publication, these recommendations are current, but make sure to reference the CDC's website if there's any question about the updated updates on these various vaccinations. Now, we've talked about the importance of vaccination, why we need to vaccinate our patients. We've talked about how to identify what vaccines to give to our patients. So the next section, we're going to talk about how to actually improve vaccinations. So the CDC, recognizing that there is suboptimal vaccination, like we've talked about. Now, I mentioned influenza, but influenza is the more popular vaccine, like you can imagine. So there are other vaccines that are less, frequently administered, which are very important for us to address in our clinical practice. And these standards for adult immunization practice, is a framework that the CDC developed to help us as healthcare professionals when to address this gap in vaccination amongst our high-risk patients, amongst our patients as a whole, but specifically for our high-risk patients. And these standards were developed bearing in mind that not all healthcare professionals actually administer vaccines in their clinics. So whether or not you give vaccines in your clinic, this set of standards should be able to be applied by everybody that sees patients to be able to improve their vaccination rates. And we're going to talk about those standards. So these are the 4 key steps in the standards. The first is to assess immunization status for all your patients at every clinical encounter. Okay? Strongly recommend vaccines that patients need. Administer or refer your patients to a vaccine provider. So help them to get vaccinated. And finally, document vaccines received by your patients. And we're going to go over each of these steps quickly. So assessment. This involves, first of all, you can't assess if you're not sure what you're assessing for. So us being informed is really critical to be able to assess the need for vaccination. AACE guideline has, which is one of the reasons we have the updated vaccine recommendations. The CDC's website is also a good resource. So stay informed. Make sure your staff is informed. Secondly, implement protocols and policies in your clinical environment that will help you to routinely review the patient's vaccination need, what the patients need. And all things like when you're checking your patients in to assess, how you can have your MA have a checklist of, the vaccines they should have received, and then ask questions if they've received those vaccines, and that can be a flag that can be, they can forward to your clinic for you to discuss with the patient. You can send reminders to the patients ahead of their clinic visits with the checklist of the vaccines they should have received, such that will be another tool to identify those that need to be vaccinated. Recommend, that's the second step. So it's simple, we need to recommend vaccines to those patients we identify that need to be vaccinated but have not received their vaccination. These are some strategies that we can use to initiate that discussion about recommendation. Share the reasons why they need to be vaccinated, highlight some positive experiences. This could be your experiences or experiences of other patients that is, of course, HIPAA compliant. Address questions and concerns that they may have. Okay, there's a lot of information about vaccines, but also a lot of misinformation out there in social media and online. So make sure to listen to their concerns and give them evidence-based reasons why the vaccines are important. Remind them of the value of getting a vaccination, both in preventing illness to themselves, to their families, the cost of not being able to walk, for example. So these are some things we can use. The third step is to administer or refer your patients. So if you have the vaccines in stock, give it to them. I'm sure that most offices may not have any of these vaccines. But again, this is another key point of the steps, which is to recognize those that need to be vaccinated and refer them for the vaccination. Most local health departments give vaccines. Also, most commercial pharmacies, also like Walmart and CVS, also administer vaccines. I also point out that sometimes cost is a concern, but the Inflation Reduction Act that was recently passed has a provision for 100% coverage for vaccines for Medicare beneficiaries. So keep that in mind. And this is a website that you can use to find health centers in your local area or in the patient's home that we can use as a way to identify where they can receive these vaccines that we do not stock. And the final step is to document vaccination status. How many of us here are aware of immunization information systems in our states? Okay, good. How many of us use EHRs? I think everybody. So how many of us are aware that EHRs are supposed to communicate with these systems? So that's, well, so that is something that is a requirement of the meaningful use in EHR by CMS. We're supposed to, our EHR is supposed to communicate with the state system in a bidirectional manner, which means that if we vaccinate our patients, that information should go to the state. And if a patient receives a vaccine elsewhere, it goes to the state and it goes to our EHR. And the rationale for that is that by knowing what your patient has received, first, you avoid duplicate vaccination. Sometimes patients are not very sure, did you receive influenza vaccine? They'll be like, huh, you know. So you recognize that sometimes patients may not be fully aware of what vaccines they've received. Also, it will save you time, right? If your EHR is capable of picking that information up, then you don't spend time discussing a patient that is fully vaccinated, asking them about vaccination. And document in the patient's chart. And finally, follow up. If you refer the patient to get a vaccine outside of your clinic, follow up with them. And if they received it elsewhere that doesn't have the link with the IIS, you enter the information so that it's available to everybody else. So some tips and strategies, I already mentioned some of these in the course of our discussion. Assess your office process. Determine what vaccines you have in stock, and then what you don't have, and when you refer your patients, where you refer them to. Make sure to educate yourself and your team to be able to identify what the patient's needs are. Find immunization champions. Immunization champions are people that are advocates, that are visible in your practice, that promote vaccinations. That has been shown to be effective in increasing vaccination. And by the way, physicians, the CDC data shows that only about 30% of primary care providers routinely assess for vaccinations amongst their patients. So there's a lot of gap that we can, impact that we can make by improving these vaccinations. So this is just for information. There's CDC, in recognizing all these gaps in vaccinations, is making efforts to improve vaccinations amongst our patients. This is a cooperative agreement with this Council on Medical Specialty Societies. AACE is a member of that specialty society, and they awarded a grant for quality improvement projects that we can use to identify strategies to improve vaccinations across our patient population. So stay tuned for that information as time goes on. And then the final slide is just directing you to the AACE website. There's a lot of resources, some podcasts, downloads, and links to the CDC website that you can use as a reference for your improving vaccinations for your patients. So in summary, we've talked about immunizations, how they help to prevent bad outcomes for our patients with low vaccination rates. We've reviewed the updated AACE diabetes guidelines. We've discussed the standards for adult immunization practice, the CDC standards. And I'll encourage you to talk to your colleagues and also to learn more about the vaccinations to be able to improve the vaccinations for our patients. I'd like to acknowledge that this presentation was provided by AACE through this grant, Specialty Societies Advancing Adult Immunization, funded by the CDC, coordinated through the Council on Medical Specialty Societies. Thank you.